Hey, I'm Gary Takas. I'm here at Keating Dental Arts in Irvine, California as a guest of my great friend, Dr. David Hornbrook. We just recorded a podcast, one of the episodes of his Dental Up podcast. You've got to listen to that. We shared some valuable information that will help you develop a thriving practice. While I was here, I wanted to take a minute and share with you the 5 most important KPIs, key performance indicators, to measure in your dental practice. And these are KPIs, key performance indicators, that you may not have thought of in terms of how to measure performance in your practice. Number 1, I want you to start measuring the whitening volume in your practice. This is very simple. I want you to measure how many whitening procedures you do in a month. And those could be chairside, it could be take-home trays, or it could be a simple over-the-counter product that you provide to your patients. And this KPI is filed under the category of things that are measured improve. When you start measuring this, it's going to improve. The reason I'm so excited about whitening is a gateway service. The more whitening you provide to your patients, the more likely they'll be interested in other restorative, elective, and cosmetic services. Your goal is 1 a day, 1 a working day. So if you're working 16 days a month, 18 days a month, I want to see you get to the point where you're doing 1 whitening procedure a day. Second KPI, I want you to measure your new patient case acceptance percentage. Simply track this. It's likely that your dental software allows you to track this. Track the amount of dentistry that's been diagnosed against the amount of dentistry that ends up being scheduled. The amount of dentistry diagnosed and the amount of dentistry that is scheduled. This is a very enlightening statistic, key performance indicator to start measuring. I'm a big fan of data. Data never lies. People do, and when I say people do, I don't mean that in a bad way, but you tend to remember things anecdotally. Before we started tracking this in our practice, if I would ask Paul, my business partner, Dr. Paul Nielsen, if I would ask Paul, how are we doing on case acceptance? He might say, well, I think we're doing pretty well. I saw 2 new patients yesterday, and both of them accepted my treatment recommendations. I think we're doing pretty well. But in fact, that may not be our actual data. But when you start measuring this, you're going to find out how you're doing regarding case presentation and case acceptance. Number 3, this is a fun one. This is one of my favorite. I want you to start tracking what your production is at the beginning of your day versus the end of your day for total office production. For example, that might look like this. I'm going to make up numbers. Let's say between you, doctor, and your hygiene department, you start the day at $6,000 in production. I want you to then measure where you're at the end of the day. And the goal that I want you to do is at the end of the month, I want you to have more days where your production ends up higher at the end of the month than what it was when you started at the beginning of the day. That will show that you've developed a culture of being able to add in treatment during the day. Perhaps emergency patients that you see where you add in some treatment, perhaps hygiene patients where while they're there, we're able to do some restorative dentistry to save them a trip. But one of the characteristics of a thriving practice is they end the day with more production than when they started at the beginning of the day. 4th KPI, I want you to simply track the number of Google reviews, new Google reviews that you have at the end of the month. By the way, what's the number 1 search engine in the world? Google. What's the number 2 search engine in the world? Who cares? Because it's literally who cares. Now, just for trivia's sake, in case you're on Who Wants to Be a Millionaire, and the question is, what is the number 2 search engine? It's YouTube, which is owned by Google. So you want Google reviews. Start tracking your Google reviews. And the goal is to come up with more Google reviews each month in your practice. The last KPI that I want to introduce to you is a little bit technical. I'll take a minute and kind of explain this. 4 different dental codes, 4341, 4342, 4355, and 4910. I want you to track those codes as a percentage of your practice, as a percentage compared to 1110, compared to an adult prophy. Now these are all periodontal codes. This is SRP, full quadrant SRP. This is SRP 1 to 3 teeth. This is a gross debridement. This is a periodontal prophy. I want you to track your percentage of these codes compared to an adult prophy. And in a healthy practice, according to the authorities, in a healthy practice, these codes collectively should be somewhere between 25 and 30% compared to your adult pro fee. Well, there's 5 KPIs to start measuring in your practice to improve the performance of your practice. It's been great to share this information with you. Please, I'll circle back around to the very beginning. Take some time and listen to the wonderful podcast that David and I, the interview we just did on Dental Up, where I talk specifically about how to reduce insurance dependency and how to break free from the shackles of insurance. Thanks for joining us.